Hi, Dr. Scott Haydon, Austin Plastic Surgery Institute here in Austin, Texas. I want to talk to you a little bit about fat transfer to the breast. This is something that we get a ton of inquiries for, and today I'm going to present a few patients that are good candidates and show you why we chose fat transfer as opposed to putting in an implant. A lot of times when patients call, they're wanting to use fat instead of an implant. The trouble is, and the downside to using fat is that you might get a half a cup, 1 cup at the very most. Unfortunately, a lot of those patients that are calling just simply don't have enough fat. And I know everyone's like, oh no, I got all this fat. You really don't in a lot of cases. So I'm going to show you a few cases and explain to you why we use them. So this is an 18-year-old girl born with a significant asymmetry, constricted lower pole over here, and a very ptotic breast, left side. So you can see on the left, she's got a lot of droop. Again, she's only 18. This is just a congenital thing. But this right side really never developed. So what I did is I did a lift on the left side. I put in a tiny bit of fat in the upper pole here. But on the right side, I simply added fat. And so this is a great outcome. The upside was she got rid of fat where she didn't want it, and we were able to place it into an area that did her some good. So you can see she's got a fantastic result, and this is at 1 year. And obviously you can see the lift scars, healed well. Everything that was done on the right side is almost scarless because it's done just through tiny openings. So this is a patient who was having tummy tuck done, also some liposuction. She had had a previous mastopexy, which is a breast lift. So basically, instead of throwing the fat away, we collected it and processed it. We have a process in a machine called Viality, which really allows us to separate good fat out, take all the blood and other materials out, and we're able to get a success rate of about 70 and maybe 80% in some cases, whereas before it was only about 50%. And I started using this when I was doing a lot of breast cancer reconstruction to help shape the breast and give an improvement. But again, this is a good outcome. You can see she doesn't have, a lot of fullness, but she's got a little bit more in the upper pole in particular. And so if you look at the before and look at the after, this is kind of what, she wanted. And again, this is a 1-year result. From the side, you can see just a little bit of fullness in the upper pole, a little bit of expansion this way. You can see on the oblique view, same thing. Now, this is a patient who is the final one, and she too just really wanted to have a little bit more fullness. She was going to be having a tummy tuck and liposuction at the same time. And so again, instead of throwing the fat away, I said, well, we could, put a little in your upper pole and in the medial area, kind of give you a little more cleavage. You can see also with the expansion of the breast envelope, you can see more skin in the bottom lower pole. So the distance between the areolar border and the inframammary fold has been stretched out some. So again, this is 1 year. You don't expect this fat to go away. But again, these are a few isolated examples of when fat transfers work very well. But you also have to understand that not everyone is a candidate for the fat transfer. So lastly, I would just say for those that are not sure, we can also use the Vectra 3D imaging. We can show you various images and simulations with various size implants, and that really gives you a good idea what an implant would look like if you decide to go that route. And we can show you small implants as well as any size that you want. So anyway, I hope that kind of clears things up. If you have any questions about breast augmentation, whether it's with fat transfers or with implants, give us a call at Austin Plastic Surgery Institute, and we would love to help you.